Hi, my name is Shivani Gandhi, and I am an AmeriCorps Vista volunteer at To Our Children's Future with Health, Incorporated. We at To Our Children's Future with Health work to empower youth, adults, and communities towards healthy living. In this short segment, I would like to show you the many obstacles and challenges that youth in Philadelphia face today. West and North Philadelphia are considered to be healthcare shortage areas, meaning that there are not enough health professionals in the area to provide adequate health care to the community. This is a map showing the percentage of households living in poverty. Areas that are darker represent the communities in Philadelphia with the greatest numbers of families living at or below the poverty line. As you can see, West and North Philadelphia have very high percentages of household poverty as compared to other areas in the city. Youth in these areas of Philadelphia are disproportionately affected by life and health issues, ranging from gun violence to chronic disease. The next map shows the number of juvenile gunshot victims in the year 2006, ages 7 to 24. Aside from the alarmingly high number of gunshot victims throughout Philadelphia, notice that there is a greater concentration of victims in the west and north regions of Philadelphia. The next map shows the areas in Philadelphia with the highest percentages of childhood diabetes, childhood obesity, and childhood asthma. Notice again that there is a high concentration of these conditions in West and North Philadelphia. It is important to recognize that juvenile violence and chronic diseases among children, along with many other issues faced by youth today, are largely preventable and/or maintainable provided that youth receive meaningful guidance as well as the proper preventive and primary health care. Since West and North Philadelphia are medically underserved areas, it is ever essential that we reach out to the youth in these communities to ensure that they obtain the quality of life that they deserve. How does To Our Children's Future with Health reach out to these youth? To Our Children's Future with Health integrates after-school programs with preventive health to ensure that youth in West and North Philadelphia thrive, succeed, and maintain a healthy lifestyle. We hope that this short segment has inspired you to join TOCFWH's effort in improving the health of our youth.
Our model is actually made up of 5 components, and while they're not in any particular order, they're all very important to the success of the work that we are trying to do. So again, the 5 components that we have are resources, policies and procedures, strategies for implementing our policies, educational trainings, and evaluation, or what we also consider monitoring, but evaluation and research.
My name is Rohini Killen, and I'm an AmeriCorps Vista with To Our Children's Future with Health, Incorporated. Today I'm going to be presenting to you an educational training entitled The Importance of Annual Physicals, the Annual Physical Exam, and Your Role. So please sit back and enjoy. So why aren't more physicals happening? First of all, the importance for youth is underestimated. A lot of people think that, youth, they're young, they're healthy, they probably don't need to see a doctor so often. There's a lack of immediate motivation for a lot of people. Again, that goes back to youth being or seeming healthy all the time, and there's no real reason to run to a doctor. A lack of health insurance, which is a big problem in this country. A lot of people can't afford to go see doctors for annual physicals. And there's also a lack of community resources and partnerships. There's not that much information available about where one can get an annual physical or what the problems are and what you should ask your doctor about when you do go. We can now talk about how we as a community can work together to ensure that our youth get this type of health care.
I'm Rohini.
Hi, and I'm Erica Perquette, and we're here at Shepherd Recreation Center today, May 29, 2009. We're here for our special event, and we're actually down here at the table doing physicals right now. Rohini, do you want to tell them a little bit about the physicals?
Sure. We're here we just have the registration table out here, and we're going to send them in to that room over there where the Thomas Jefferson doctors are waiting, and they'll be performing large physicals for all of our kids who are coming in.
Hello, my name is Dr. Randall Drain, and I'm from Pediatric and Preventive Medicine Associates. Some of the things we're doing today are screening the children's weight, height, taking their blood pressures, Also measuring their BMI, which gives us a good idea about whether they're obese or not obese. Also doing limited physicals, listening to their heart, checking their eyesight, which includes their vision. And this is a very good event. I'm happy to be a part of it.
Good afternoon. My name is Dr. Jim Plum, and I'm from the Department of Family and Community Medicine at Thomas Jefferson University. Today we're doing physicals on the children who are involved in a variety of programs that the organization is running through the year. We enjoy coming out and meeting with the kids, having time to chat with them, address some of their issues, making sure they're getting the care that they need, getting them back to their doctors, and overall meeting folks in the communities where they live, which is a much more realistic look at health and determinants of health.
One of the main aspects of collaboration and the power of it is that you're bringing a community together. This approach is really beneficial, and it's an approach that hasn't been used or talked about that much in reference to one of the hottest topics today, which is healthcare reform. We haven't seen a lot of bottom-up community collaboration around this issue. So our effort toward collaboration is particularly important because it's a way that we feel that we can prepare ourselves for the healthcare reform that's about to take place. Whatever form it takes, one of the things that's really necessary is that a community is ready to receive the services and taking control of some of the services that are available to them.